The term gender affirming care, gender affirming surgeries is describing a more patient-centric term to make sure that the whole health system is an affirming environment for our patients.
Care is always individualized, and it is a multidisciplinary type of care that requires certain attention with some complexity of the cases.
The first step is names and pronouns, and I think that is so important. I think that's something that's overlooked.
Having those pronouns in the medical records is enormous, even though it's just one line. It makes a huge amount of difference for how gender-affirming care is offered at Temple.
Gender-affirming surgeries are surgeries that better align a patient's physical characteristics with their gender identity.
We currently deliver facial feminization surgeries, different types of mastectomies, breast augmentations, different body contouring procedures, bottom surgeries of feminization and masculinization, including vaginoplasties, vulvoplasties, metoidoplasties, and phalloplasties.
This is like a very personal job for me. I'm myself trans, non-binary, and I myself had surgery. I remember how difficult it was to navigate health systems. I didn't know where to get care. And so I imagined what it might be like for other folks navigating the system.
In some instances, patients may feel like they have to jump through a lot of hoops or a lot of barriers for them to getting to surgery. And so a lot of them are worried that they might not be able to have surgery for one reason or another.
My role is to introduce people to the program, get them registered in our health system, get them connected to the surgeons that they are seeking, and also other primary care, specialist care. Some of the concerns that come across are, am I going to be able to afford this? Will my insurance cover this? Will I have enough support for this? How will I get time off of work? What sets the Temple Gender Affirming Surgery Program apart from other surgical programs is that we really want to make sure that folks are supported, not just to make sure that they are a good surgical candidate, but that they have the supports they need in order to have good surgical outcomes.
We make sure that we take away the stress of the surgery and the after surgery care in a way that the patient does not go through the surgery without knowing what would come next. Their care would not finish at the moment that the surgery is finished. We'll see them after the surgery, we'll follow with them, and we want them to consider us as a member of their own extended family.
Almost all my patients tell me that it's been a lifetime of waiting, that they've known that they were trans from a very young age, and especially my older patients will tell me that when they were younger, they didn't have the choice. And so some of our patients have made that transition later on in their lives. Our younger patients have transitioned earlier, and so patients come to us in all different parts of their lives.
Being on hormone therapy for over 20 years of my life, it was time to make greater change. I felt very comfortable with everyone I came across. The nurses, the care providers, everyone did a marvelous job at Temple Health. This has changed my life dramatically, where I am feeling more confident, I am feeling more complete. Dr. Douglas became my new friend, and our relationship is out of this world. We connected from day one. I told her how I felt about certain things, and she said, we're gonna get this done.
Having patients tell me that how life-changing and life-saving this surgery has been is so incredibly rewarding, and it's really special to be a part of such an important time in our patients' lives.